Hi, everyone. Thanks for joining me for another Break for 8 for Dementia Care Partners, where we do approximately 8 minutes of dementia education followed up with about an 8-minute meditation or relaxation exercise. My name is Anne, and last time I talked about physical and occupational therapy. And I realize that although these professions are very familiar to me, many people aren't quite clear about the specific roles of occupational, physical, and speech therapists. So I just wanted to take some time this morning to define each one and explain the differences. So I think most people are pretty familiar with the role of physical therapy. So let's begin there. So a physical therapist is a licensed clinician, meaning they practice their practice. They've received education in their practice, so they've graduated from a physical therapy accredited program, and they've taken an exam, and they also obtain a certain number of continuing education hours each year to maintain their license. And this is the case for all licensed clinicians, including occupational therapists, speech therapists, nurses, psychologists, social workers, and many others who you may encounter on your dementia journey. So physical therapists in general, they are going to evaluate a person's mobility, strength, balance, and they provide recommendations for mobility equipment and exercises, and they can also use various modalities to reduce pain. And PTs are going to perform other roles when it comes to different populations they serve, like orthopedics or pediatrics, but this is what I commonly see when they are working with a person living with dementia. Speech therapists, or you also might see them referred to by their professional name, which is speech language pathologist. The abbreviation is SLP for speech language pathologist. So again, they're another licensed clinician who's done the work they need to qualify and maintain their license like a physical therapist. And speech therapists are going to assess communication, cognition, and also swallowing. And they provide valuable insight along with some instruction in compensatory strategies or retraining techniques. So say, for example, you notice or suspect maybe your person is having some difficulty with swallowing. You may observe them to cough a little bit during a meal, or maybe some excess drooling, or maybe they just exhibit some symptoms with certain consistencies like thin liquids like water. So the speech therapist is a specialist who can evaluate this and then suggest some strategies for just making life easier. They're also experts at addressing aphasia, which is a disorder that affects most people, but living with dementia at some point or another. And aphasia is a decrease in the ability to either understand or express language, or both. So, many of you can now understand probably why you may encounter or want to seek out a speech therapist to help you meet the needs of your person living with dementia, because they're involved in communication, cognition, swallowing. All of these are going to be impacted at one time or another as dementia progresses. So finally, but last but not least, I'd like to tell you about occupational therapy, which is what I am. So I also am a licensed clinician like the others with similar requirements for practice. And I think what can be confusing about OT is the name, because occupational usually refers to work, like an occupation or a job. But when it comes to occupational therapy, we consider the word occupation as something that keeps people occupied. So this could be a job, or it really could be anything. So that people do to keep them engaged and occupied. So occupational therapists involved in dementia care are going to typically evaluate the impact of dementia on everyday life. So this OTs can help you determine, the level of assistance needed with activities of daily living also known as ADLs. You may have heard that before. ADLs include driving, handling finances, even the ability to live alone. OTs can assess these areas. They also can suggest strategies to deal with, challenging situations like refusing to participate in an ADL, like bathing. And they can also make home safety recommendations to make that home environment more accessible. And finally, OTs, pretty good at suggesting engagement activities to help a person living with dementia, continue to be as engaged and as independent with ADLs as possible. So one of the other things sometimes you'll see is some overlap when between the therapies when it comes to dementia care. And, because all of us are going to work on modifying activities to help increase safety and independence. A physical therapist may suggest a walker, for example, as a modification to help with walking. A speech therapist may suggest sticking to certain foods or liquids with a certain consistency, to help modify eating so it's safer and the person has a lower risk of aspirating their food and getting pneumonia. And an occupational therapist may suggest, using a piece of adaptive equipment to make something like eating easier. So for example, they may build up the handle of a fork or a spoon to make it easier to grip if your person is losing fine motor skill. And sometimes just to confuse you a little bit more, we can overlap. So for example, both the physical and the occupational therapist can complete a home safety assessment. And, it may end up being more appropriate for PT, if the primary concern is a decrease in balance. But an occupational therapist may be a better choice if there are visual changes or safety concerns related to cognition. But fortunately, I find that OTs, PTs, and speech therapists all work together pretty well. And, we can review a case and can pretty quickly determine, amongst themselves, who is going to be the best fit for the client, because we certainly don't want to confuse things and duplicate services, and we're not allowed to do that anyway. So I guess my best advice would be, if you notice a change in status, either communication or cognition or physical ability, or sensory status like changes in vision or hearing or even an increased sensitivity to things like noise, therapists a therapy order can be requested from your medical provider. And the therapist then can use their assessment tools to gain a better understanding about what's going on, can educate you, and in many cases are just validating what you're seeing already. But maybe they have some tricks and tips that can help make life easier for you. So I hope that description, helps explain what the different therapies are and what they do. And importantly, how they can make your life easier as a care partner. And I guess what I would also say is that sometimes we can bump up against the diagnosis of dementia and people, even medical practitioners, having a little bit of stigma with it, like they aren't going to improve. They don't need therapy. I find this really a really challenging opinion, because we can make life better. We can make life safer. We can make life easier for the caregiver, and just better all around. So you may have to be a little bit of an advocate when it comes to requesting a therapy order, but hopefully most people who are experienced dementia care providers are well aware of the benefit. All right, everybody. So now it's time to turn your attention to yourself for a few moments and hopefully make your life a little bit easier. Let's introduce a little quiet and some stillness into your day as we begin our meditation. So please go ahead and get comfy and close your eyes if you feel like it. And as you settle, please bring your awareness to your breath. You may want to place your hand on your chest or your abdomen and just bring awareness to the rise and the fall of your chest and abdominal wall as you breathe in and breathe out. I thought today that during our meditation time, I would borrow from the toolbox of my physical therapy friends and incorporate some gentle stretching into our session today. Of course, if you have an injury or you encounter any discomfort with these stretches, please use your judgment and discontinue the movement. You always can just fall back and follow along with gentle breathing. So staying seated with your arms at your side, just begin to slowly roll your shoulders in one direction. Just feel your shoulder blades and your shoulders move as one as they lift and lower, and then reverse the direction. Let's do this about 5 times. When you're finished, you can pause and just return your awareness to your breath. If needed, just drop your shoulders down, away from your ears, just to ensure they are totally relaxed. Now please drop your head to the left side, bringing your left ear to your left shoulder. You should feel a gentle stretch, but nothing sharp, nothing painful. Let's just hold the stretch for a few moments. If you want, you can just drop your opposite arm and extend your elbow to deepen that stretch just a little bit, but only if that feels comfortable. And we'll continue to hold here. That you're hearing is not your neck. It is my dog, Violet. So now let's repeat the same thing on the right side of your neck, just dropping the neck to the side, extending the arm and the elbow if you like for a deeper stretch, and just hold here for a few moments. As you come out of that stretch, just rotate your head from side to side, just very gently, as though you're shaking your head no a few times. And now, if it's comfortable, bring your chin down to your chest, feeling that gentle stretch in the back of your neck. Again, if there's any tightness or pain, any contraindications for moving your neck, please just return to your breath. And for a final neck movement, just please now look up at the ceiling above you. You can try clenching or bringing your teeth together to increase the intensity of that stretch down the front of your neck. And hold here. And as you come out of that position, please feel free to just gently move your neck from side to side or whatever direction feels good to you. And just now return your awareness to your gentle breathing, drawing your attention to the way your chest rises on the inhale and falls on the exhale. Just like stretching, returning to a space of stillness and quiet can help us relieve tension and tightness. So let's just stay here for a few more moments. If your mind begins to wander, just send those thoughts on their way with another gentle breath, knowing you can return to them later. So to end our session today, if you can, just please extend your arms up over your head. And let's just lean to the right side and hold that for a moment if it's comfortable. And then lean to the right side if it's comfortable. Kind of feeling that stretch up and down your side. Let's return to center. Roll your shoulders one last time in opposite or the same directions in reverse. And then finally, let's take a deep breath in and a big exhale. Take one more like that. Inhale and a strong exhale to end today. So good luck, everyone, today.